Hello, everyone. Welcome to tonight's program on medication safety and adherence presented by the UIC Asian Pharmacists Association. We're so grateful for their support and in bringing us this program. They usually come and volunteer in person, but however, due to coronavirus restrictions, we were not able to have our annual event that they normally come help at the health fair. And so they graciously brought us this program tonight. We'll give everyone a couple minutes to check in. Let us know where you are viewing from. You can put it in the comments. We'd love to see where everyone is watching from. And I see we've got 17 people watching now. That's great. Welcome. And thank you for joining us tonight. So I'll start by telling you a little bit about the Japanese American Service Committee, JASC. We were founded in 1946 to assist with Japanese Americans who had been incarcerated during World War II. Once they were released from the incarceration camps, the community needed assistance in finding housing and jobs and reestablishing their communities. And so that's when we were founded to assist and help everyone kind of find themselves and find homes and reestablish community. Now, however, our jobs are much different. What we do is much different, and we serve our community in a variety of ways, primarily to express 4 core values. For the children's future is one of our core values. In honor and care of senior citizens, cultural exchange, and also a sense of mission. One of the ways that JSC is supported is one of our biggest annual fundraisers, which is Holiday Delight. This year, that will be Saturday, November 14th. And unlike past years, we will not be able to have an in-person event. We are going to have a drive-through food pickup and online programming. And we have a short clip to show you about Holiday Delight.
Hello, it's that time of year again. Hold the date, November 14th, Saturday. It's our JASC's annual fundraiser in the fall, Kodomo Matsuri, Holiday Delight. As you can see, wearing a mask. And so the program is going to be a little bit different, but we're going to have a lot of fun this year. We will have curbside pickup for food as well as drive-through. We'll have performances. We will be live streaming a program that will show cultural arts and activities and just celebrating as best we can in this moment in time. More details to come, and please come out and support the Japanese American Service Committee. We really appreciate it.
And that was our CEO, Mike Takada, bringing us that message. So keep an eye on social media. We'll have details coming shortly about ordering food and our online program as well. And now it's time for our Asian Pharmacists Association to start their presentation. So welcome, everyone, and thank you again for bringing this to our community.
Hello, everyone, and thank you for tuning into our presentation today about medication adherence and safety. We're just going to give a short introduction about ourselves. I am Alexa Abernilla. I am a first-year pharmacy student at UIC.
Hi, everyone. My name is Diane Baroya. I am also a first-year pharmacy student at UIC.
Hi everyone, my name is Ann Dam. I'm also a first-year pharmacy student at UIC.
Hi everyone, I'm Cherry Fan. I'm also a first-year student at UIC College of Pharmacy.
Hi, my name is Tia Lee. I'm a third-year pharmacy student at UIC. We can go to the next slides now. Okay. Have you ever wondered why it is so important to take medication as prescribed? What consequences are associated with medication non-adherence? Since medication non-adherence result in poor clinical outcomes and increase unnecessary healthcare costs, therefore we would like to cover some strategies that could be utilized to improve medication adherence and reduce the risk of safety events resulting from the appropriate use of medication. In fact, poor medication adherence can lessen drug efficacy and lead to greater disease complications. We would like to answer your concerns if you ever experience any difficulties from getting prescription filled, take medications on time, or any other issues resulting you from taking your medication as prescribed. We're hoping this presentation can help you understand how poor adherence affects clinical and economic outcomes, how to break the barriers of medication adherence, how to utilize strategies to improve overall medication adherence and drug safety.
Hi, everyone. So, as we all know, there are many people in the US that suffer from an illness or a disease. This is known as a morbidity. According to the CDC, 6 in 10 adults have a chronic disease, and 4 in 10 adults have 2 or more illnesses. This is known as a comorbidity. Comorbidity is the simultaneous presence of 2 or more diseases, illnesses, and or conditions. Next slide, please. There are many illnesses that people may have, which could range from chronic non-communicable illnesses to highly communicable illnesses like tuberculosis. Common chronic non-communicable diseases together, thus making them comorbidities. Next slide, please. More than likely, people that have an illness or are sick undergo treatments and or take medications to treat, cure, or alleviate symptoms of their illness. With taking medication comes medication adherence. Now, what is adherence? According to Mosby's Medical Dictionary, adherence is defined as the process in which a person follows rules, guidelines, or standards, especially as patients, to follow a prescription and recommendations for a regimen of care. Adherence can be as simple as following the instructions indicated on your prescription.
Now, before exploring adherence further, I want to first bring up this statistic on global medication adherence. According to the World Health Organization, or WHO, only 50% of patients with chronic diseases are adherent or take their medications as prescribed by their doctors. Now, this statistic further decreases as the number of comorbid diseases increase. This is basically saying that the more diseases that a patient has, then the worse they are at being adherent with their medication. Now, this is a very worrying trend to think about, as poor adherence may worsen your disease state, make you more weak, and has been shown to be the leading cause for increased healthcare costs and early deaths. We are here with this presentation to try and address this adherence problem so that everyone know that it exists and to try to help solve and overcome it. So the World Health Organization also determined that there are 5 sets of factors, which they term as dimensions, that are important for older adults in order to adhere to medication regimens. These dimensions are you see on the slide: social and economic, healthcare system, condition-related, therapy-related, and patient-related. As we proceed, we'll be taking a closer look at each dimension. So the first dimension we'll be looking at is the social and economic. So low health literacy has become an important social and economic risk factor to medication non-adherence. Patients that are 65 years or older particularly have a problem with this. And if you don't know what low health literacy is, an example could be a patient having difficulty reading and comprehending medical information that is important to their health. A study conducted by the CDC noted that there was a strong trend between age and health literacy issues as well, with a steady increase of 15.6% for patients 65 and older. This suggests that as age increases, health literacy decreases. Problems with health literacy are associated with less knowledge of chronic disease and health management. And in regards to the economic factor, finances may interfere with obtaining medications and can be the cause of adherence problems. Not obtaining medications can lead to not taking medications, then can lead further to the declining of one's health. It's important that you always seek out assistance when needed and reach out to your healthcare providers to reevaluate your medication list. With evaluations, non-essential medications can be removed, and your doctor can even substitute certain medications for the generic form, which can possibly alleviate prices.
And their impact on patient adherence. The quality of relationship between a healthcare provider and a patient is another important factor impacting adherence. Many older patients may be suffering from multiple illnesses and are being treated by several healthcare providers. The continuity and coordination of care is of utmost importance to maintain health and control of illnesses. It is good for providers to maintain a good relationship with their patients, but patients should also do the same to help benefit their health. Patients should not fear their provider, but they should verbalize every question and concern they may have for the provider to enhance their treatment experience. A better treatment experience with your provider will increase adherence. Now, moving on to a more patient-specific aspect, which is condition-related. Not all conditions experience the same symptoms or side effects. Chronic conditions and lack of symptoms highly impact the level of adherence. Chronic conditions such as high blood pressure, hyperlipidemia, diabetes, osteoporosis, and depression are common illnesses that have few or no symptoms, which remind individuals to take their medication. When patients do not perceive that their illness is chronic or requires preventative treatment, adherence is generally poor. Adherence is generally greater for medications that provide symptom relief as opposed to those that use treatment for generally just asymptomatic conditions. Moving on, another patient-specific aspect we can look at is therapy-related. So therapy-related factors include the complexity of medication regimen and the unpleasant side effects that comes along with it. Complex medication regimens are a significant factor that deters people from adhering to their medications. Many older adults have conditions and or multiple conditions, leading to the use of multiple medications at the same time as a necessary part of their care. Studies have shown that medication adherence rates decrease when the treatment is long-term and it involves multiple medications that must be taken concurrently. Taking more medications can be more difficult to keep up with. So dosing several times daily is also another factor, and it may contribute to non-adherence even more than the overall number of the medications taken. So evaluating medication regimen with your provider and keeping it as simple as possible will promote adherence. Again, older adults often suffer increased side effects related to the lack of their body to eliminate medications from their system as efficiently as like a younger person. It can be quite scary to take medications that may cause a headache or a stomach ache, but such side effects should not deter you from taking medications that will ultimately help your health. Unfortunately, individuals, yes, choose not to adhere because they have no control over how they feel. Specifically, assessing for medication side effects and managing your minor side effects and identifying alternative medications with fewer side effects are strategies that you can speak to your provider about if it is of great concern and is deterring you away from taking medication.
So now I'll be going through the last dimension listed by WHO, which is the patient-related dimension. Perception of need, which is medication effectiveness, and safety are all important patient-related factors for medication adherence. As patients decide to fill their prescription, they take into account the necessity of treatment and the seriousness of their disease. So building relationships with healthcare providers is important, but being able to schedule follow-ups is also necessary in maintaining that relationship. Follow-up appointments can also provide patients with the opportunity to address any other concerns they have about their medications, as well as discontinue any non-essential medications, change prescriptions when necessary, and explore other solutions to increase adherence. And now that we've gone through some factors to adherence, I'd like to go through some ways that anyone can improve their medication adherence. So the first way is self-managing. This includes making sure that you are organizing yourself to make taking medications easier. You can use pill boxes and put each medication and the time of day you need to take each medication. You can also ask your pharmacist if they have programs where they can fill your pill box for you. Writing down your medications on a calendar can work as well if that's better for you. Using labeled phone alarms, which can ring at specific times of the day to tell you to take a certain medication, is another way. Developing a routine is also important because if you're taking the same medication at the same time of day, it will be harder to forget to take any medications. And then the second way is to raise concerns. If you have any concerns, like if you don't like a specific side effect that a medication is giving you, it's important to know that you can tell your doctor your concerns instead of just not taking your medication. If you are confused on why you are taking a medication or what exactly your medication is doing to help you, it's a good idea to ask your doctor or even the pharmacist when you pick up your prescription. Your doctor or pharmacist is there to help you, but you have to raise concerns to them too. And then the third method is asking for help. There are other people other than your doctors and pharmacists that are there to help. There are caregivers, family, and even friends. You can ask things that you are unsure of, like why you take a medication or how this medication helps, like I said earlier, or you can ask someone with help filling out your pill box if you're having trouble, or even ask family members to make phone alarms or even text or call you to remind you every day to take a medication if you're having trouble.
Now I will take you to answer the question, what is medicine safety? Medicines are generally safe when used as prescribed or as directed on the label, but there are risks in taking any medicine. According to CDC, each year in the United States, adverse drug events, harm resulting from medication use, cause more than 1 million visits to hospital emergency departments. Learning about medication safety can reduce and even prevent the risk of harm for you and your loved ones. Generally speaking, there are 3 most common types of medication, some of which might sound familiar to you. These include over-the-counter, also known as OTC medication. All these terms refer to medicine that you can buy without a prescription. They are safe and effective when you follow the directions on the label and as directed by your healthcare professional. The second one is prescription medication. These are the ones that require you to go to a healthcare provider, a doctor, a primary physician, in order to obtain a prescription for the medication to be dispensed at the pharmacy. The third one is alternative or traditional medicine, typically in a form of herbal plants, leaves. We are providing some tips for safe medication use here. For yourself as a patient, write each drug and dose in your medication record. Don't forget any over-the-counter medications, such as vitamins and minerals, herbal supplements, cough and cold allergy medicines, aspirin, pain and fever, topical. Update your information as things change. This is very important. Keep your medication record with you and show this information to your doctor and pharmacist at every visit to ensure there is no conflict medications. As Alexa mentioned earlier, the better you communicate with your doctor and your pharmacist, the better they can ensure that you have the best medication for your needs. Don't be afraid to ask questions regarding the medications you are taking, its usage, dosage, side effects, interactions, and speak up about your medication or any symptoms that you experience. Also remember to check the expiration dates on your medications. Dispose of expired medications to prevent taking those that may not be effective or may be potentially toxic. As a healthcare provider, our job is to create and maintain a safe environment, open to questions from the patient. Healthcare providers need to ask questions, express their concerns relating to patients' health conditions. The healthcare provider also educates regarding benefits or desired outcome of the medication treatment versus the risk of side effects. The prescriber may change medication based on the individual's wishes, as Diane mentioned earlier. All discussion must be done in a manner that the individual or parent guardian understands. The discussion of benefit versus risk of medications must be documented in the record.
So now we'll be discussing how to properly store your medication at home. In general, most medication should be stored in a cool, dry place at room temperature, out of the reach of children, and not in direct sunlight. Some medications may require to be refrigerated or specially stored or handled. Always ensure that the safety cap is locked and make sure that the instructions on how to properly store your medications are clear when you pick up your prescription. And if not, please ask questions. It is important that medications are stored correctly so that they don't degrade, lose their effectiveness, or become cross-contaminated. When traveling with your medicines, keep them in their original containers in your carry-on luggage. When you do travel, do not pack them in your check bags just in case that the suitcase might get lost. Also, make sure to bring a copy of your prescription. Next, we'll go through several ways to dispose your unused medications at home. Generally, there are 2 ways to dispose your medication at home according to the FDA website. The first method would be flushing your medication. This way is pretty self-explanatory, in which you just flushed out the unused medication that you're no longer needed down the sink or toilet. The second method is to dispose your medication in household trash. Refer to the image on the screen for the proper step. So the first step would be to mix with an appealing substance. The second step would be to place it in a sealed container, and the second step is to throw it into the household trash can. And the fourth step is to scratch out all the personal information on the bottle, because you would not want to leak those information. However, if you're unsure, please do not hesitate to ask and double check with the pharmacist on how to properly dispose your medication. So now we'll be discussing overdosing. According to Addiction Center, an overdose is a biological response to when the human body receives too much of a substance or a mix of substances. An overdose can be intentional or accidental. People can overdose on illicit drugs, alcohol, prescription medication, and many other substances. In many cases, overdose can be fatal, although most individuals who have overdose can be saved if medical treatment is provided quickly enough. In terms of drugs, there are a few different ways your body can become overwhelmed by substances. However, the most common cause of death during chemical overdose is respiratory failure. Common symptoms of an overdose are rapid heartbeat, increased body temperature, chest pain, dilated pupils, difficult breathing, nausea, vomiting, seizure, aggression, unconsciousness. A person may not experience all of these signs, but even a few of these symptoms can indicate that a person is experiencing an overdose. Please call for help immediately if you are experiencing abnormal symptoms after taking medication. Call 911 if you witness anyone with overdose symptoms.
So with this presentation, we went through two very important topics that I hope that everyone learned something about. So those two topics were medication adherence and medication safety. Though a lot of information was presented, I want to go through some take-home messages for you all. So in regards to medication adherence, it's important to know that self-management is a good first step, but that you can always ask for help whenever you need it for whoever is around you, whether that be a healthcare provider or family, friends, or a caregiver. And then for medication safety, make sure that you take medicines as prescribed or as directed on the label. And again, ask questions if needed. There are no bad questions.
Thank you, everyone. That was really, really educational. The main thing that I got from the presentation was how important it is to communicate with your healthcare provider and your pharmacist regarding medications. So thank you. It's very helpful. Do we have any comments or any tips? Does anyone have anything to add about ways that help you remember to take your medications properly or on time? I know you mentioned having a list of medications with you at all times, and I found that if I put a list of my medications in my phone contacts list, I always have it, because I remember the names of my medications, but I never remember the dosage. Is it 150 milligrams or 15 milligrams? So my trick is to put it in my phone. That way I have it. Or I take a picture of the label as well. Oh, great. So we've got a question. So what should I do if I miss a dose of medication and don't realize until the next day? That's a great question and super common.
I can answer to that question. So if you miss a dose, just remember to take it as soon as you remember. But if it's too close to the next dose, just wait until the next dose to take it. I hope I answer your question.
Great, thank you. And our next question is, if I am currently taking, I'm not sure if I'm going to say this properly, Warfarin, Warfarin. Is it okay for me to flush that as well? So that's a question from someone. I know that you described ways to dispose of medications, but I also know that some local police departments have medication disposal boxes in the precinct. I know the city of Chicago does. I'm not sure about the suburbs, and you would have to check with your local municipality, but it's probably always safer to use the medication disposal boxes, I would think. All right, any other questions? And a comment that someone takes a picture of their medication labels as well. And that's an easy way to show your provider what medication you take. Does anyone have any other tips for us? How about our pharmacists? What do you use and how do you manage your medications?
So I can answer that one. I usually use phone alarms because that helps with me because it tells like the time and then I can put the medication because there are times that I will forget to take like vitamin D supplements. So when I hear the ring and I see the, oh, take your vitamin D, I think that's a very good way to remember to take my medications.
Anyone else?
Another good thing about that is you want to get somebody else involved, especially when you're an older person that tends to forget or even forget to set an alarm. You want to get somebody, maybe someone you live with or a caretaker, to be involved with your medication adherence, because so then they can tell you when to take it and when to set the alarm. It's always good to have like a care provider.
I set alarms to take my medications, but then sometimes I forget whether or not I've taken them. Any hints for me, or am I just kind of hopeless?
Do you live with someone, like your children, your grandchildren?
My cat, he's not very communicative.
Okay. But you have anyone that talk to you every day, like your grandkids will call you every day or something?
No.
Okay. In that case, I hope you can have maybe a whiteboard that maybe every day you wake up, you can check mark, you can write out your medication and then check mark that, hey, you did it, or, you know, so hopefully that by that way you can remember. Even myself, I have, you know, young mind, but I tend to forget too. And I have whiteboard in front of me to remind me what to take or what to do every day too. So hopefully that helps.
That's a good idea. Thank you. Okay, we've got another question in. What can I do if I have a hard time opening my medication bottle? This person is a senior citizen, because I know some of those bottles are very difficult to open.
Yes, so you can walk into your local pharmacy and you can consult the pharmacist about getting an easy cap open instead of the twist. An easy cap to make it easier for you.
Oh, that's great. And we've got a comment that the village of Skokie offers a medication drop box at their police headquarters. Yeah, I think those are becoming more common now, and that's good. Thank you for that information. And any other questions? And I know, actually, I know one of the things that was shown was a pill box. Can you explain a little bit about the pill boxes with the days of the week on them? What
Yeah,
might be
sure.
the best way to use those?
I can go through that. I find that pill boxes are helpful for if you have multiple medications. So they'll have each day of the week, and usually they'll have them in big letters. You can look on the store or on Amazon. There are a lot of them with different like colors and things like that. So usually they'll have each day of the week from Monday to Sunday, and then they also have the time of the day. So it'll be like a sun, or it'll say like morning, and then it'll say noon, and evening, and then bedtime. So you can put in each box each medication that you need to take.
Oh, great. So those are really handy.
Mhm.
All right. Any other questions? And I know most of the questions are kind of addressing more practical ways to remember to adhere to your prescriptions and medications. I know in my family, my son had a problem one time with the medication and wouldn't take it because of the way it made him feel. So we realized it was important that he communicate that to his doctor, so they could try a different type of medication. And I believe you addressed that in your program as well. So that's really helpful. So definitely one of the main messages is to make sure you communicate with your healthcare provider. Okay. So here we've got a question. There was a slide about not using a pill box during travel. So can you elaborate on that, please? Why do you keep your meds in the original containers when you travel?
Yeah, I can answer to that. Unless Anne, you wanna answer that question?
No, it's okay. You can go ahead. I can add some more information if needed.
Definitely. Yes. As I know, if you use the pill box, when traveling, there may be turbulence, and the pill box can be open or messed up between different dates. So in that case, you may take wrong medication. So it can be dangerous. And you want to add to that?
Yeah, totally. When you have your medication in your pill box, it's kind of like your personal knowledge to know what medication is in the pill box. So like if someone else saw the pill box, they might have just taken that and without knowing that, like the children might take that without knowing that it's like medication. So then that would be harder for you to just have control over that. So it would just be safer for you to use the original packaging when traveling.
And then what about carrying a copy of your prescription when you travel? Why is that important? Has anyone ever, what if you travel to a foreign country? Is it possible? Does anyone know, or does it depend on the country whether or not you can get a prescription filled?
Um, okay, it's always good to bring a list of your prescription medications in case you get into an accident or you got food poisoning. When you admit to the hospital, they would know what medications you are on. So when they give you new medication, you won't have a conflicting reaction to the medication they give you. Am I missing anything?
I think that's pretty good. Any last questions? All right. So I think we are just about finished here. So once again, I would like to thank the UIC Asian Pharmacists Association for bringing us this really helpful presentation. It will be available as a recording on Facebook and YouTube on the JSC pages. So please check Facebook for the links or find JSC on YouTube. Thank you very much, everyone. And we really appreciate your time. And thanks for joining us tonight. I hope everyone learned something. And hopefully we'll see you soon. Thank you.
Thank
Good
you so
night.
much for having us.
Thank you,
Bye.
everybody.
Thank you.
Thank you.